Hey, my name is Brian, a student from Humber College, and I'm in the massage therapy program. Today I'm just going to be talking about IFC, the reasons for application of IFC, the benefits, some precautions, and some contraindications. Alright, so to start off, IFC stands for interferential current. It is a type of electrotherapy and it is a modality used in chiropractic, massage therapy, and physiotherapy. IFC, to start off, why would we use IFC? So, when a patient comes into clinic and they're presented with pain, any swelling, any denervated muscles or muscle atrophy, that is an application. That is a reason to use IFC. So the benefits will just branch off with that. People who have acute or chronic pain, IFC could definitely decrease pain for them. So a person comes in clinic and they just had a ligament sprain, or they have a mild fracture, like a hairline fracture that might be causing them pain. IFC could definitely decrease pain for them. Also with tendon injuries or any musculoskeletal injuries, IFC could help. People who also have denervated muscles or muscle atrophy, like I said, it could definitely re-stimulate the muscle, and it could re-educate the muscle and actually start it off as kind of like a baseline for people to get ready for remedial exercise and get their muscle going again, kind of like a start off for muscle re-education. So that's a good positive benefit for people who have denervated muscles. That's a good way to start off the remedial exercise. And a few other benefits is that it could decrease swelling, and it could decrease swelling, and it could increase range of motion. So people who have decreased range of motion is sometimes due to edema or weak muscles. So if you decrease the swelling and edema at a certain joint, like the shoulder joint, knee joint, or hip joint that has swelling around the area, you could definitely increase range of motion. And if the range of motion is due to weak muscles, you could re-stimulate, re-educate those muscles and hope for a positive effect by an increased range of motion and decreased pain. Alright, so moving on, we've covered reasons for IFC and the benefits of IFC. So now I want to move on to like precautions and contraindications. So with precautions, there's just a few areas of the body, more like around the head, that you don't want to apply the IFC pads to and turn them on. So you don't want to put IFC pads on your temples, and you don't want to put IFC pads near the eyes, on the cheeks. You definitely don't want to put IFC pads in your mouth, just for the sole reason of it's electrotherapy, and if something does go wrong, you don't want to shock the muscles around your head. You don't want to promote any kind of injury to the brain, or you have saliva in your mouth too, so it could conduct electric waves and it could cause an injury. You don't want to apply IFC to the front of the neck. You don't want to apply IFC to your groin, or if a person, more specifically a female, is menstruating, you don't want to be applying IFC to the low back as well. So those are a few precautions that you want to watch out for when applying IFC. And now we'll just be moving on to the contraindications. So contraindications of IFC, you always have to ask your patient if they have like a pacemaker, if they have also a person who is pregnant, any malignancies, any surgeries around a joint or area, any metal plates. You don't want to put IFC on that. And as well as a female who is menstruating, you don't want to put IFC on their low back or on their groin area. So that is it for contraindications, precautions, benefits, and reasons for IFC. Again, I'm Brian Manrique, and that's it for today.